My name is Hannah-Sharon Mills. I'm a pediatric resident, which means I'm training to become a pediatric specialist. I work at the Korlebu Teaching Hospital. I've been there for the past 5 years, and I've been in medical practice for the past 8 years. I'm married with 2 boys, and yes, that's it. NICU stands for Neonatal Intensive Care Unit, and it's a specialized unit in a hospital where babies who have problems right from birth are taken. This includes preterm babies who are born before they should have been. With prematurity, there are 2 main categories of babies. There are the early preterms and the late preterms. Pre means they came before they were supposed to, and a term baby is one who was born between 37 and 40 weeks of gestation. So any baby who is born before 37 weeks is a preterm baby. With the late preterms, they're usually born between 34 to 37 weeks, and early preterms are born before that. And depending on when the baby is born, they could have more severe complications. And in our country, in Ghana, there's something called the age of viability. And this is the period before which a baby is considered to have at least a 50% survival rate when they are born. So that means babies who are born before 28 weeks are not considered to be viable, even though there have been cases where some babies have survived this period. And at the Neonatal Intensive Care Unit, there are various healthcare workers. There are doctors, there are nurses. So with the doctors, you have the house officers, the medical officers, the residents, and then the specialists. There's usually a neonatologist who is in charge of the unit and helps to manage the babies who are born at NICU. There are also various nurses, including pediatric nurses, who also aid in taking care of the babies. With preterm babies, they could have various issues, but one of the ones that we are most concerned about when they are born is their respiratory system. Because they are born too early, they usually have problems breathing on their own, especially with the early preterms. And sometimes they even forget that they need to breathe. So some preterm babies just stop breathing. And because of this, when a baby is born preterm, they are sent to NICU, and in a lot of cases, they are assisted to breathe. So they may be put on ventilators, or the medical team may have to manually ventilate the babies. Or in some cases, they may just be put on supplemental oxygen to help their respiratory system. In advanced countries, they are given a compound called surfactant, and this is naturally produced in the lungs, but because these babies are born too early, they don't have the ability to produce the surfactant. In the NICU at Korlebu, this isn't available. So a lot of the time what is done is that the babies are put on a machine called a CPAP machine, which helps them to breathe. And they are given some medication that also assists their brain to help them to remember to breathe. Apart from the respiratory function, they may also have problems with controlling their body temperature. And this is because they are not born with enough fat or subcutaneous tissue. So they have difficulties keeping themselves warm. And that's why a lot of babies are put in incubators to help regulate their body temperatures when they are born. And as they get bigger, they are moved out of the incubators and into cots. And they may also have problems with controlling their blood sugar. Their blood sugar can go very low, and they may also develop neonatal jaundice. So their eyes may become yellow and they may need to be put under blue light. Some babies who are born preterm also have a risk of bleeding into their brain, and for these reasons, they'll need long-term follow-up. So these are a few complications that preterm babies might have. When preterm babies are born, we correct their gestational age. Even though They may have been said to have been born at a certain date by a scan that was done early in the pregnancy, or from the mother calculating from the date of her last menstrual period. These methods aren't always so accurate. So depending on the physical features that the babies have and their muscle tone, their ability to move their joints in a certain way, we look at all of these characteristics and then we assess them as having a corrected gestational age. So for instance, a preterm baby will be assessed as being born at 30 weeks, when from the scan, the pregnancy would have been 32 weeks. So based on that, when they come for follow-up at the NICU clinic, we adjust their age so that we can compare their development to their peers using the corrected gestational age. And this is because it's not fair to compare the two babies, one who was born at the time he or she should have been and a preterm baby, because the rate at which they develop and are able to achieve certain milestones will be different. So apart from assessing for the developmental milestones at the NICU clinic, we also follow them up for long-term complications. For instance, some babies might have bled into their brain, so we need to keep on monitoring their head size to make sure that they don't have any complications that could be developing following that. We also monitor their vision. We send them for hearing assessments, and when babies are going home, they usually go home on multivitamins or micronutrients, and we may need to adjust the doses of that. So that's done at the NICU clinic. Preterm babies are also at risk of anemia of prematurity. And this occurs because when they are born too early, normally in the last few weeks of pregnancy, the mother transfers certain factors to the baby. And this helps to do various things. It helps with their immunity, so they are decreased risk of infections. It helps so that their hemoglobin, their HB levels up, so their blood levels don't go too low. So some babies are in fact, all preterm babies are started on iron supplementation during their stay at the NICU or after they've been discharged at the NICU clinic. So these doses are also adjusted during the follow-up clinic. We also monitor to make sure that the babies are getting their immunization, so they are protected against the vaccine-preventable diseases. And if the parents have any other concerns during the clinic, these are also followed up. About 4 years ago, I had a friend who had a baby, and the baby was brought to NICU because she was born too early. She was born at 27 weeks and 4 days. And that's the earliest I've seen. As far as I know, the earliest that a baby has been brought there is 27 weeks. And she's doing well now. She's a healthy, happy 4-year-old. She goes to school. She's running around. She's a big sister now. She's doing very well. So KMC stands for Kangaroo Mother Care, and it's basically continuation of care for the preterm baby. And it's important because it does several things for both the mother and the baby. It prepares them for being finally discharged from the NICU. KMC helps babies to regulate their body temperature, because when a mother is doing KMC or a father is doing kangaroo father care, the baby is placed directly on the mother or father's chest, so there's skin-to-skin contact. And with that, there's heat transfer from the parents to the baby, so that helps to regulate the baby's temperature. And it also helps for the mothers to pick up any abnormalities that may occur. If the preterm baby is on the mother's chest and stops breathing because of the impaired respiratory function, the mother can easily pick this up and report to the medical team. And it's been found that babies who have KMC with their mother are at decreased risk of infection, and this could be because the normal bacteria on the mother's skin is transferred to the baby, and when this happens, the baby's immune system is able to produce antibodies, and antibodies from the mother are transferred to the baby, so that helps to keep the baby safe from infections. think with us, it's mostly logistics or with resources, because a lot of the time the equipment that we need to help the babies isn't available. And with that, I think this is important because creating awareness about prematurity and what needs to be done will help with the healthcare system, and eventually things will trickle down and what is needed to be done will be done, so that the equipment that we need to help save the baby's lives will be made available. Okay, so when you're training to be a specialist, you go through various rotations. I think the NICU rotation is one of the most rewarding because the babies come in so small. Sometimes they are very sick, and they're not able to feed, they get infections, they get jaundice. But after a few months, you're able to discharge them. And a year or two down the line, when you see the parents coming back to you with their children walking, children in school, children happy, it makes a big difference knowing that you were able to make a difference in that child's life. Yes, I think it's important to let the families know that it's not the mother's fault, it's not the father's fault that this has happened. Sometimes these things just occur without reason. So the most important thing is for the families to support the parents in taking care of the babies. And the fact that you've had a preterm baby doesn't mean that your life is over, the child's life is over. There have been survivors, there are survivors, and there's hope for preterm babies. Your preterm baby can go to school, can become a medical doctor. I actually have a cousin who was born preterm and is a medical doctor now. So there's hope for preterm babies. Don't give up on your babies. And I know it's difficult having a baby in the first place, and even more difficult when that baby is born preterm. So the important thing is not to give up hope. Know that there's a support system out there for you. As much as possible, we as the healthcare workers will be there when you need us. And the family should support parents as much as they can, and the babies will be fine.